Hello and welcome back to Casual Conversations. This is a video series presented by the Association of Cannabinoid Specialists that features panel discussions with physicians and scientists on various topics related to the use of cannabis as medicine. My name is Christine Goedhart. I will be the moderator for this episode's conversation, and I'm joined by our panel of cannabinoid physicians, which includes Dr. Jordan Tishler and Dr. Adam Abodeely. Thank you both for being here. Well, today we're going to focus on Parkinson's disease and the role that medical cannabis may play in managing its symptoms. There are an estimated 10 million people worldwide who live with Parkinson's, and as the population grows and ages, this number is only expected to increase. And with limited treatments available, people are increasingly turning to cannabis to manage symptoms and improve quality of life. So let's delve into this from a clinical standpoint. I'm very interested to hear from each of you about how this has shown up in your practice and your perspectives on the best ways to support patients living with Parkinson's through medical cannabis treatment. So, Jordan, how about let's start with you? Please tell us a bit about your clinical experience with using cannabis to treat patients with Parkinson's.
Thank you. Sure. So over the last 15 years, I've certainly taken care of several hundred folks with this illness. And as you pointed out, it's a terrible illness, and we've got very few treatments to offer. And certainly at this point, we're not really able to influence the course of the disease itself. But with some significant success, we can start to influence people's quality of life and symptomatology using cannabis or various cannabinoids. It's been interesting to me because if you go to YouTube, you can find videos of supposed Parkinson's patients who are, having a significant tremor, and then you see them light up a big bowl, and then they exhale, and miraculously their tremor is gone. And I can't really comment on the veracity of those videos, but I can say that a number of studies have looked at the benefit of cannabis for Parkinson's, and interestingly, generally show fairly little benefit to the tremor itself. And so, the tremor is clearly a primary symptom in Parkinson's, and as well as difficulty with movement initiation, and and those sort of the primary symptoms, and then you have this sort of secondary cluster of anxiety and insomnia and restlessness. And what we've seen is that while the cannabis is sort of not super great at those primary symptoms, it's very effective on those secondary symptoms, and that's really kind of where we get the best bang for the buck. And that's been my clinical experience as well. That those primary symptoms may respond. It's kind of idiosyncratic, but the issues around that anxiety and restlessness and the insomnia, those are things we can very well address. I will say that one of my patients, who I saw for years, maybe over a decade, had a lot of those secondary symptoms. The other thing is there's weight loss associated in the advanced stages. So again, cannabis comes into play for appetite stimulation, and he is doing really well in terms of those secondary symptoms. But over time, the tremor became so pronounced that unfortunately he couldn't feed himself anymore. And then he and I got into a really lengthy discussion about looking into deep brain stimulation. And I, being the sort of skeptic that I am, was not tremendously enthusiastic, but he actually found a clinic down at the Mass General Hospital where they were doing this routinely, and he went ahead and did it, and it was night and day for him. So, I mean, obviously that's not a cannabis related thing, but it was a very, very positive thing for him in terms of those symptoms. And then when we mated that with his success from the cannabis side, it was a really dramatic reset for him in terms of functionality and quality of life. It was wonderful to see.
Yeah. Great. Thank you for sharing. What about you, Adam? Does that align with your experience? Is there anything else that you'd like to share?
Yeah, no, well, first I'll say that, given my specialty in GI work and surgery, I probably haven't treated nearly as many patients with Parkinson's as Dr. Tischler has, but I have treated a few patients. And treating Parkinson's is, it's largely like, in a lot of ways, it's like almost like treating like PTSD. The first thing is just trying to figure out, well, what symptoms are, what are you trying to accomplish, with the cannabis? Are you trying to, cure, reverse Parkinson's? Like some people believe, that it has the ability, to do as same as with, same reason some people choose to use cannabis for cancer, due to its potential chemotherapeutic properties. And so there's always some education that goes on in the beginning of really trying to nail down what are the main indications. And the few cases that I have, I'll say it's broadly been defined as use for to improve quality of life symptoms, in general. And quality of life is one of these things that's extremely hard to classify, define really the variables that go into it. But a lot of the same variables that we're talking about where cannabis has shown improvements, things like depression, anxiety, and insomnia, all of these in a large way contribute to quality of life. So, in the cases where I've treated these patients who really, are looking just for, in a lot of ways, just kind of the improvement in quality of life, and large that comes down to, the mood enhancing effects that it could have for some of these patients, which helps alleviate some of their depression, which helps alleviate some of their anxiety, and helps them sleep better. All improves it all just contributes to an improved quality of life, however, we define that. But just like any other patient that comes for cannabis, the use, same as inflammatory bowel disease, the first thing they're trying to figure out is, well, why do you want to use cannabis for your inflammatory bowel disease? We know that it might not cure or reverse the inflammation, but it certainly can help with symptoms and decreasing reliance on other medications, decreasing hospitalization. So trying to work with the patients to try to figure out what are we trying to accomplish first and foremost, I think is extremely important. If we could, get somebody to decrease the amount of, anti-anxiety medications they might be reliant on, or antidepressants they might be reliant on. These are all important considerations when working with Parkinson's patients. The tremor component to it, again, with my patients, that has not been the main indication. It's more been, a quality of life, issue. So I can't say for sure whether I recall them reporting improvements in their tremors or symptoms. It was much more aligned with quality of life indicators.
I think it's also really interesting what you touched on about sort of understanding very critically the difference between disease modification and symptom modification or quality of life stuff. And this comes up in almost all of the neurodegenerative as well as the cancer related fields, is that there's some preclinical evidence that uh, all of the cannabinoids are anti-inflammatory, and then people throw around this term sort of neuroprotective. I'm not entirely sure what that means in any sort of rigorous fashion. And my take on that is if you're a test tube with cells in it or you're a mouse, then that's good news. But we need to get, to the point where we've done the translational work to see whether this makes any difference in the intact human being. And actually, your reference to inflammatory bowel disease or specifically Crohn's is a great example because people talk about how cannabis is extraordinarily helpful for their quality of life, but we also then have studies that show that even though they're taking in those anti-inflammatory cannabinoids, it isn't enough or it isn't effective to actually modify the underlying autoimmune disease. And then there are some studies that show some specific things that may do that, but it's not just sort of generally smoking weed. And so there's that difference between quality of life and disease modification really has to be central for us as we're thinking about patients. And hopefully, sometime not too long from now, that translational science will catch up, and then we'll be able to say, yeah, you know what, cannabis itself is good for the symptoms, but this cocktail of specific cannabinoids might actually then affect the disease, like we're starting to see with Crohn's.
Mhm. Yep. Yeah, and I also, I think it's also important in this population too, not to, to try to work with them too, not just to be layering on another medication too. If you can work to try to minimize, anything else they might be taking, I think that's, the one of the roles too that cannabis can play in these patients. If they're requiring too many, if they want to cut down on any of their anti-anxiety medications, if they're requiring, sedatives to go to sleep or any sort of medications to help them sleep, if this can provide either, an alternate or allow for some dose adjustments from, with those other medications, that has potential benefit too, just in even just preventing some potential side effects, dizziness, falls, all that type of stuff, which you have to be mindful of people with Parkinson's, as well.
Yeah, absolutely. That's a funny thing too, because sometimes that gets taken to an extreme. And if somebody is on a lot of benzos, for example, being able to replace that or diminish the need using cannabis is definitely a great thing. But the flip side is, you get people who come in and they say, I want to use cannabis instead of my chemo, or I want, for my Crohn's, I want to stop the Remicade, right? And you're like, "Nah, yeah, right." So again, it's really kind of understanding what this stuff can do and being able to respond to our patients in a supportive manner that, helps them with the things that can help and sort of remind them that it's not a cure-all and it isn't going to fix everything when they get in their head from somewhere like the internet, that they should just come off all their drugs.
Yeah. No, no, absolutely. And that's a continued, challenge in cannabis medicine is people want to, it to be a cure-all. And I do believe that cannabis is, in particularly in cases of Parkinson's and majority of the things we treat, is it's an adjunctive medication. It can be an alternative in some instances, but not in not in not in too many, you know.
Right, right.
Even people who tout CBD for, for as an anti-seizure medication, truth be told, is even people that are using, CBD, for seizures, still 90% of them are on another seizure medication. So, you hope that they're, using it so they can either diminish the number of seizures they're having as an adjunctive therapy, or diminish side effects or dosage requirements or whatever the case, may be. Um, I think we're learning that more and more about cannabis every day, is that it's a wonderful adjunct in a lot of cases.
Yeah, yeah. I actually don't know, what the literature says about using CBD, for example, as the primary anti-epileptic. Almost all of the studies have looked at it, as you said, with at least one or more, traditional or conventional anti-epileptics on board already. Um, I don't know whether there are studies that look at it as sort of the primary anti-epileptic. I think that GW did some of those studies, because I know that they proved that it was not simply increasing the blood levels of other anti-epileptics, but I don't recall off the top of my head how those studies were accomplished.
Yeah, no, nor do I.
Okay, I'm wondering, what practical advice would you give a physician who's new to considering cannabis for treating Parkinson's?
Well, I can start out with that. And, as I first stated, I think the first and foremost question is, what is the indication for it? What are you trying to accomplish from it? If somebody comes in and says, I want to come off all my Parkinson's medications because I don't believe they're working, then that's not the right answer. It's trying to figure out where can it really be effective. And there are some people it can be it can be tremendously beneficial for with tremors, but I think largely its benefit lies in its ability to improve quality of life and help with some other symptom indicators of quality of life, if you will, such as depression, anxiety, and insomnia.
I think I would only add to that, almost more of a cultural thing at the moment. Um, Most of the contemplation of cannabis is very sort of patient self-directed. And particularly with Parkinson's patients who are relatively frail and prone to things like falling over, although cannabis generally has been shown in the geriatric population not to increase falls, certainly people with Parkinson's with their gait disturbance, et cetera, are at higher risk to begin with. And so sending our patients out to sort of titrate themselves, I think is probably not in their best interest. And so, and they're also going to get, unfortunately, a lot of well-intended but misguidance from at the point of sale, in the dispensary, et cetera. So I think that it sort of becomes that much more important for us as the clinician to say, look, I want to start you on a really low dose. I want you to get, say, a gummy and they're 5 milligrams, but I want you to cut it in half. And I want you to start at 2.5 milligrams. And yeah, it would be lovely to jump to the place where it's working for you really quickly, but we're going to get better results, safer results if we titrate very slowly, so that in another patient, I might titrate up over a week or so, each dose level. But with somebody who's elderly and frail, I might titrate up over several weeks, 2 weeks, 3 weeks, that sort of thing, really to let to let their body acclimate, to let their understanding their psychology acclimate. Of course, many of our patients, particularly those who are older and who may have Parkinson's, are going to be people who don't use cannabis to begin with. Or maybe oh, Sonny, I smoked some in the 1960s, but nothing since, that sort of thing. So, being very gentle and having the kid gloves on, I think will get us to a better outcome. And certainly we don't want to overdo it because then they will never come back, right? If we give somebody too much cannabis, they will have a bad experience and they will say, oh, this is just pothead stuff. I mean, I unfortunately have had patients say that sort of thing to me. And if they get off on the wrong foot, there's really very little opportunity to backtrack and slow it down and get to where we would like to get to. They're just going to wash their hands of it.
Yeah. Yeah, no, that's a good point. And you know, as always, even with elderly, I agree. When it comes to THC, I start very low and go slow kind of situation just to make sure they're not going to have any side effects. And the last thing we need is somebody getting dizzy and falling after their first dose of a cannabis, because that'll be the last time they'll ever, use cannabis probably, and the doctor will probably be blamed for recommending it.
Absolutely, absolutely. And you just kind of touched on the very common mantra, start low and go slow. And on some level, I think that that's very good wisdom, but I think it's also missing a few elements. So, what is low, right? Where do I start? Well, typically I would start at 5 milligrams. But if I have somebody who's frail or worried about the effects, then I will start even lower at 2.5, right? And then the go slow part is great too, but it doesn't indicate any sort of an upper limit, right? And we know people who certainly have cannabis use disorder who went slowly but just kept going and going and going like the Energizer Bunny and ended up in a bad place. So, I tend to think of 20 milligrams per dose as a relative upper bound on the THC side, and would typically dose that orally once, not once, twice, or maybe 3 times in a day. So really kind of thinking about 60 milligrams of THC as kind of a relative upper limit. Now, interestingly, sometimes in older folks, I see that they need actually a little more than some of the younger folks. I can't explain that. It's just an observation. But again, once you get up to the 20 or slightly over the 20 milligram, I just say, keep your eye on them, right? Just keep your eye on it so that it doesn't become, a runaway train or that they don't develop a lot of side effects and that sort of thing.
Well, those are great points. And as far as titrating up, I'll tell them, again, 2.5 milligram increments. I just want to make sure that, they're tolerating any potential side effects and, go up until the point where they feel they get symptom relief. And to your point, 20 milligrams is exactly what I tell people too. I say, hey, more than 20 milligrams, we should kind of chat or figure out if there's something else going on here.
Well, thank you so much for this very interesting conversation. Before we close, I'd like to ask each of you to share one key thing you want the audience to take away or a hope that you have for the future of cannabis and treating Parkinson's. So, Adam, let's start with you. What do you want to leave us with?
Well, that's a great question. I think it would certainly be interesting if we were able, right now as we mentioned, a lot of its utility is in controlling, kind of the end stage of the disease and a lot of the symptoms that go along with the end stage of the disease. But it certainly would be nice from cannabinoid medicine in general to have a better understanding of if it has an ability, particularly earlier on. Knowing that a large percentage of people with Parkinson's, there is a genetic component in a lot of the cases to know if there might be a potential role in utilizing the endocannabinoid system to affect disease progression and phenotypic expression, if you will, over time. So, hopefully the bench scientists and the translational researchers can slowly help us figure that out.
That's cool. Sure.
What about you, Jordan? What do you want to leave us with?
I think my parting thought is that for Parkinson's, cannabis can be very, very helpful. And if anybody who's listening to this has Parkinson's or knows somebody, I would absolutely encourage them to seek professional care. But the flip side of that is that this is one of these things where just kind of willy-nilly winging it on your own or with the bud tender's advice is probably not going to lead to an optimal outcome. So I really would recommend that people in those positions find a clinician like Adam or myself or others available through the association who can really help guide this process to ensure a good outcome.
All right. Well, thank you for those last words. I want to thank you both, Dr. Jordan Tishler, Adam Abodeely, for sharing your experiences and insights into this topic with us today. And for those of you watching, I want to thank you for taking the time to listen to this conversation. I hope you're leaving with a better understanding of the clinical perspective of using cannabis to treat Parkinson's. And if you're interested in learning more about cannabinoid medicine, please check out the education section of the ACS website, which includes videos, blogs, and courses on a variety of relevant topics. You can find all of this at cannaspecialist.org. And if you aren't already, please consider becoming a member and joining us in the effort to advance evidence-based cannabinoid care and to shape the future of medical cannabis through education, research, and advocacy. Thanks again. I'm looking forward to seeing you next time.